A mole is also known as a nevus. The nevus form is a benign non-cancerous pigment tumor, often appears as small dark brown spots that are caused by a cluster of pigment form called melanocytes. Babies are not usually born with mole. They often benign to appear in children and young adults. These mole look may change over time, and they also fade too. What if we have many mole? Most mole will never cause any problem. They are harmless. But someone who has many mole is more likely to develop melanoma. Being aware of changes in your mole and other pigments hat is important to fighting skin, especially malignant melanoma. And what is malignant melanoma? Melanoma is malignancies called from the malignant transformations of melanocytes. Melanocytes are derived from the neural crest. Therefore, melanoma, although derived from the skin, can develop in other locations where neural crest cells migrate, such as the gastrointestinal tract and vein, and cause of melanoma. Most melanoma are caused by exposure to ultraviolet light or UV light. These light come from sunlight or tanning lamps and bed. Limiting exposure to UV light can help reduce the risk of melanoma. Limiting exposure to UV light can reduce risk of melanoma. Type of mole. Atypical mole or dysplastic nevi. These moles look a little like normal mole, but have some features of melanoma. They are often larger and have an abnormal shape or color. And this is the picture. They can appear on the skin that is exposed to the sun, as well as skin that is usually covered, such as on the buttock and scalp. Dysplastic nevi often run in family. A small percentage of dysplastic nevi may develop into melanoma, but most dysplastic nevi never become cancer, and many melanomas seem to arise without pre-existing dysplastic nevus. Dysplastic nevi syndrome or atypical mole syndrome. People with this inherited condition have many dysplastic nevi. If at least one close relative has had melanoma, the condition is referred to as familial atypical multiple mole and melanoma syndrome. People with this condition have a very high lifetime risk of melanoma, regular skin, so they need to have do regular skin exam by a dermatologist. Sometimes foodie photos are taken to help the doctor recognize if moles are changing and going. Many doctors recommend that these patients be taught to do monthly skin cells exam as well. And second, congenital melanocytic nevi. More present at birth are called congenital melanocytic nevi. The lifetime risk of melanoma developing in congenital melanocytic nevi is estimated to be between 0 and 5%. Depending on the size of the nevus, people with very large congenital nevus have a higher risk, while the risk is lower to those with small nevus. For example, the risk for melanoma is very low in congenital nevi that are smaller than the palm of the hand, while those that cover large portions of the back and buttocks, branching trunks nevi have significantly higher risk. Congenital nevus are sometimes removed by surgery so that they don't have a chance to become cancer. Whether the doctor advises removing a congenital nevus depending on several factors, including the size, location, and color. Many doctors recommend that congenital nevi that are not removed should be examined regularly by a dermatologist, and that patients should be taught to do monthly skin cells exam. And this is preliminary way to look unusual mole that may indicate melanoma. We're gonna use ABCDE. A is for asymmetric shape. One half is unlike the other half. B is stand for border. Looks more with irregular notch or scallop border. C is for change in color. Look for gold that have changed color or have any color or have uneven color. D is for diameter. Look for new growth in mole. Larger than a quarter inch. This is about 6 micrometer. And E is for evolving. Watch for mole that change in size, shape, color, or height. Also, new symptoms can arise, such as itchiness or bleeding. How do dermatologists remove mole? There are two main methods. First, surgical excision and shape excision. We are going to talk which surgical excision first. Excision is a very common technique for mole removal. After cleaning and numbing the area, your surgeon uses a scrubber to separate your mole from the rest of your skin. depending on the type of mole. They will take some margin of healthy skin to ensure that all the typical cells are removed, and using forceps to grab the segment. Then they lift the mole away. Mole and surgeons may apply pressure to the areas of burns. Cataract is to stop the bleeding before stitching the area back together. And shape excisions. Another common technique for mole removal is shape excision. Your healthcare provider may be able to remove a mole by shaving rather than cutting. Shape excision can provide a simple or visual for analysis, and people are generally pleased with the results after healing. But shape excision isn't useful for looking at deep tumor markings and can be used to distinguish between different types of skin cancer. Thank you for watching and listening. Goodbye!